Tell me if this sounds familiar to you. You finish peeing, you're at the urinal, you zip up, and before you know it, you got some more urine dribbling out. That is just the worst. And let me tell you, you're not alone. I hear this complaint all the time. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about that annoying urine dribble that happens after you finish peeing. So what do we call this little bit of urine that dribbles out right after you pee? That's called post-void dribble. And when you look at the data, there's a number of studies that have been done to kind of assess how often this happens, and they range at anywhere between 5% of the population to almost 58%. And I bet it's much more common than 5% based on my experience. So there's a couple theories as to why this happens. The first thought is that if you have some abnormality in the pee tube or the urethra that causes maybe a narrowing, then urine can get trapped behind that narrowing and you'll pee out whatever you can across that narrowing, and then that urine will come out later after you've completed that stream and used all the strength that your bladder has to push the urine past it. The second thought process that I think is probably more common is prostatic urethral trapping. And what that is that the prostate is a walnut-shaped organ that sits underneath the bladder around the pee tube. And over time, as I've talked about in many other videos, specifically my recent one on benign prostatic hyperplasia, it can get larger. And as it gets larger, it can be harder to pass urine across this area. And then that urine can get trapped. And what happens when you pee is, to kind of really understand this, is that men have two sphincters. One is at the bladder neck, which is right where the bladder connects to the pee tube, and one is right underneath the prostate. And so when you finish peeing, that bladder neck closes. But if you have not completely released the urine through the prostate, the external sphincter can also close, and then you get urine stuck there. And as soon as that external sphincter opens, that remaining urine will then dribble out. And as I mentioned in that last video, BPH is so common. It happens in up to 80% of men 70 years or older. You can imagine this is happening quite commonly. And lastly, there's what we call idiopathic, or we're not really sure why this happens. The thought process is there's probably some neuromuscular dysfunction of the muscles around the urethra, or the bulbocavernosus or ischiocavernosus muscles. And these muscles typically contract to help propel urine forward. And when they become weaker, which can happen with age or with certain neurologic conditions, it's going to be harder to propel all the urine forward out to the tip of the penis when you're trying to urinate. So what can you do about this super annoying problem? Well, if it's due to a narrowing of the urethra, you may also notice that your stream is kind of weak, that sometimes it doesn't come out very strong and you have to strain or push. Or you might even notice that your urine kind of comes out in a splayed stream and goes out in different directions. If that's the case, make sure you make an appointment with a urologist so we can evaluate you for the presence of a stricture and talk to you about options for treatment. You can watch my video reacting to Johnny Knoxville, who got a urethral injury during one of his crazy stunts, and I talk a little bit about the treatment for that there. If you have an enlarged prostate, there's a lot of different symptoms you might notice. You might notice that you are having a weak stream or having to strain or push to urinate. You might notice that you have to wait a little bit for your urine stream to start, or it starts and stops. Also, you might notice some frequency, like you got to go more often than usual, or urgency, like gotta go. And very commonly, you might notice that you're waking up a lot at night to urinate. And I've made videos on a lot of these things, including BPH as well as nocturia, and so you can check those out if you want to learn more about them. If you're having those symptoms, make sure you see a urologist and get treated. And you will notice that if you treat these problems, a lot of the times that post-void dribble or that little bit of dribbling gets better as well. Now, if you don't have any other problems besides this little bit of dribble, then you may fall into this category where you're having some muscular dysfunction and it's causing this dribble to happen. So what can you do? The first thing that you can do is very easy, and you can do right after you urinate. So it's called bulbar urethral massage. And so what that is you take your fingertips about an inch behind the scrotum and you push upwards towards the base of the penis, and while applying pressure, and that'll help milk that urine out. And do that once or twice right after you urinate to get that little bit of urine out. You can also stretch, squeeze, or shake the penis to help get that urine out as well. Another thing is doing pelvic floor muscle exercises, or very simply known as Kegel exercises. And I've made a video about this before, but I found that it's really hard for men to do Kegel exercises. One, because no one really teaches you how to do them, and two, it's actually kind of difficult to know if you're doing them correctly. So there's a couple of things I tell men. One, it's like the feeling of stopping the urine flow when you're peeing, but you don't want to do them when you're actually peeing. And the other thing that I've heard people say is it's like you're trying to lift your penis up without touching it. So you're trying to use your muscles to help lift your penis up against gravity. So when you do these exercises, you want to do them for about 5 seconds squeezing and then 5 seconds relaxing. You really want to make sure to have that relaxation, because otherwise you can get really, really tense in those muscles and create more problems. If you have any sort of pelvic pain or pain with ejaculation or testicular pain, I don't recommend you do any of these exercises without talking to a urologist or a pelvic floor physical therapist first.